supply an overdose antidote for high-risk patients.
Last month, Butler and Kent hospitals were the first to begin giving out these life-saving kits. By the end of August, Rhode Island's busiest hospital will be on board. As Health Check 10 reporter Barbara Moore-Silva reports, with more than 140 overdose deaths so far in Rhode Island, the hope is that these efforts will make a difference.
Rhode Island Hospital has the busiest emergency department in the state. Dozens of those incoming people who have overdosed.
We see anywhere between 25 to 50 opioid overdoses a month.
2 weeks ago, this Level 1 trauma center implemented a new program for these patients.
These are actually handed to the patient when they're discharged.
These are overdose rescue kits containing the opioid antidote naloxone. Dr. Jason Hack, an ED doctor and medical toxicologist, explains what happens when someone overdoses.
The reason that opioids are abused is they make you feel euphoric and make you feel high. The other unfortunate downside of opioids is they also affect the parts of your brain that keep you breathing and keep you conscious. So what the naloxone does is it binds to the receptors in the brain specifically for breathing and waking you up. So you wake up and you begin breathing again when administered.
But naloxone's effects are short-lasting. The effects of that high, long-lasting. So those at risk and their loved ones are reminded.
You administer the naloxone and you call 911. That should be grouped.
Another very important piece to this are the anchor recovery coaches who are on call from 8 p.m. on Friday until 8 a.m. on Monday.
Weekends tend to be busier.
In just the first 2 weekends, Dr. Hack says 9 calls were made to anchor recovery coaches. Now, these coaches have been in recovery so they can directly relate to the patient. As a result, 7 of the 9 entered some sort of treatment. Addiction is tough.
It's a long road. It's very hard. Some people, many people don't recover sort of with their first intervention, and it requires repeated intervention. However, the ability to live long enough to have these chances is so important.
And that's why handing out these naloxone rescue kits is so important. Again, it's not enough to administer naloxone. You need to call 911 immediately. Rhode Island Hospital, along with 2 other Lifespan hospitals, are now on board. Newport and the Miriam are the other 2. And that's Health Check. Barbara Moore-Silva, NBC 10 News.